we will open speech with our Indonesian language for the first time, inshallah.
Yes.
Today, inshallah, we will celebrate our webinar regarding build and maintain mental health in pandemic COVID-19. Before we started with our webinar, we will pray to Allah because outside is rain. So we hope this rain is nice to us. Allahumma sayyiban nafi'an wa la taj'alha adzaban, insyaAllah. Salawat serta salam senantiasa tercurah kepada Rasulullah Muhammad SAW yang memberikan inspirasi kepada kita semuanya sehingga hari ini kita mudah-mudahan istiqomah untuk senantiasa mengikuti ajarannya hingga maut menjemput kita. I would like to thanks to our Indonesian ambassador, Mr. Tri Tharyat. Thank you very much for welcoming to our presentation today webinar. Then also our guest speaker, Dr. Ashaf Saad Muhammad El-Hazli, consultant psychiatric in Kuwait for mental health.
Thank you.
Then also Assistant Director Nursing of Mrs. Huda Mahmud Adris, Middle East for Medicine of Aging. Ahlan wa sahlan, Metron and Doctor. For our Indonesian community, especially Indonesian National Nurses Association in Kuwait, welcome to all for our webinar today. We hope this is a nice experience for us to against this our pandemic COVID-19. With our topic today, it is nice, build and maintain mental health in pandemic COVID-19. Alhamdulillah, right now, join with us, it is from other country, from Indonesian also, from GCC country also, then of course, our colleague, nurses and Indonesian community in Kuwait join with us, inshallah, now. First of all, we will open our celebrate webinar with Basmalah together. Bismillahirrahmanirrahim. First, we will open our webinar with Indonesian national anthem, then following by Indonesian National Nurses Association anthem also. Falyatafaddal. Baik, Kak. Halo, Mbak Eka.
Iya, sebentar.
Ada masalah ya? Ada kendala ya, PK?
Sebentar ya, maaf.
Sorry. Mohon maaf Pak Dubes, ini padahal semalam kita. Oke, insya Allah. Bukan itu mereka. Nggak ada suaranya kan, Rana? No voice, no voice.
No voice.
Yes. Oke, kita lanjut saja gimana? Baik, Kak.
Iya.
Oke, kalau nggak bisa biar kita lanjut aja begitu. Oke.
Adanya Mars ini sebentar ya ini.
Bukan itu. Bukan simpan sama-sama semalam itu. Oke, baiklah. Ya. I'm so sorry for our colleague and our speaker and our Indonesian ambassador. So sorry, this is the problem. This virtual. Last night already we trial nicely. Nggak bisa mereka. Nggak ada suaranya mereka. Mereka di stop aja ya. Oke. Mohon maaf Pak Dubes, I'm so sorry. It's our problem right now. And Dr. Ashaf and Metron Huda, then all our colleagues, participants who's joined with us this our webinar. Baik, Kak. Next. Mars PPNI-nya. Remove itu.
Persatuan Perawat Nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan
di layar itu.
dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam mengabdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia bang.
Terus gimana? Nggak bisa full gitu?
Oke, enough. It's okay, enough.
Bener nggak full?
Yeah, it is not coming in our monitor. Okay, thank you very much. We so sorry. This is our mistake. It's problem with our server for Indonesian national anthem and also Indonesian National Nurses Association. Thank you very much. Kepada para peserta, rekan-rekan semuanya, especially our Indonesian ambassador, alhamdulillah join with us right now, Mr. Tri Tharyat, join with us. Thank you very much. Welcome, Pak. And our speaker, first of all, Dr. Ashaf. Welcome, Doctor. Join with us today.
Thank you very much.
Then also, Madam Assistant Director of Nursing, Madam Huda Mahmud Idris. Welcome, Doctor. And also our speaker, Mr. Bisri Mustafa, Magister of Nursing, join with us today, inshallah. And also all our Indonesian community in Kuwait and in our colleague also Indonesian and in GCC country will join with us in our celebrated our webinar. Our topic today is build and maintain mental health in pandemic COVID-19. Teman-teman yang dirahmati Allah, kami sekali lagi mohon maaf atas kesalahan teknis yang kami lakukan. Insya Allah kita langsung saja kepada pembicara pertama sekaligus opening speech dari Bapak Duta Besar Republik Indonesia untuk Kuwait, Bapak Tri Tharyat. Waktu dan tempat kami persilakan, Pak.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Yang saya hormati Pak Rana, Ketua PPNI Kuwait, Pak Lahardi, moderator kita malam ini, Pak Bisri, and of course Dr. Ashaf Hazli and Madam Huda Idris. So on behalf of Indonesian communities in Kuwait, let me first of all thank you so much for joining this very webinar. And I know that my friends, the Indonesian Nurse Association in Kuwait has been very active. As far as I remember, this is their 5th webinar during this COVID-19 pandemic period. So not only they work very hard in addressing this challenge, but also they share many ideas and many thoughts to all of us Indonesian communities, not only in Kuwait, but also all over the world. So as far as I understand, the most Indonesian nurses affected abroad are Indonesian nurses in Kuwait. 2 of them unfortunately passed away, and inshallah they get their right place next to Allah. And this topic tonight is very timely, and we started with a little bit stress, but that's part of our life, and I see we managed the stress in the beginning of the program. Let me continue in our language. Terima kasih sekali lagi PPNI Kuwait, saya salut, aktif sekali di tengah hari libur pun ingin terus berbagi, dan saya pahami bahwa topik yang dibawakan malam ini akan dibawakan oleh para ahlinya, sekaligus praktisinya tentunya Pak Bisri nanti bisa share juga. Nah, ini ingin saya tekankan tentunya adalah bahwa sesuatu yang tidak pernah kita duga dan terus berkelanjutan. Kalau kita di awal pandemi kita berbicara sedikit optimistis bahwa mungkin di akhir tahun akan selesai masalah COVID-19 ini, ternyata belum ada tanda-tanda 2-3 hari lalu ada pengesahan terhadap vaksin. Insya Allah menjadi berita baik bagi kita semua. Tapi sampai vaksin tadi datang ke Kuwait, datang ke tubuh kita, tentunya kita harus selalu waspada dan juga patuhi protokol kesehatan. Pada akhirnya saya percaya ada gium lama, pepatah lama, mens sana in corpore sano. Jadi di badan yang sehat terdapat jiwa yang kuat. Pesan saya pada teman-teman perawat Indonesia, jaga terus kesehatan. Teman-teman ini ada di garda terdepan dan menjadi pahlawan bagi kita semua. So, happy webinar. Once again, thank you very much, Dr. Ashaf and Madam Huda Adres. I'm sure whatever that you are going to share with us will be very meaningful to all Indonesian nurses and Indonesian nationals who join us tonight from Gulf countries and also from Indonesia. Selamat berwebinar. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much for our Indonesian Ambassador in Kuwait, Mr. Tri Tharyat, who is opening our webinar right now. Terima kasih sekali lagi Bapak Duta Besar yang sudah membuka pertemuan webinar kita. Mudah-mudahan apa yang disampaikan bisa kita bersama-sama Pak menjaga kesehatan semuanya, saling mendoakan tentunya. For Dr. Ashraf and Madam Huda, write our one quote. Our ambassador thought it is mensana in corpore sano. If in mahfuzot in Arabic it is al aqlus salim fi jismis salim. Yeah, in our body it is should be there is also strong will our thinking. Actually it's like this. This is Indonesian quote. Thank you very much. Sekali lagi makasih Pak Dubes. Mudah-mudahan acara kita ini berlancar dengan baik. Thank you very much once again. Teman-teman yang dirahmati oleh Allah Subhanahu wa taala, terima kasih. Selanjutnya kita akan mendengarkan keynote speaker yang akan dibawakan oleh Ketua PPNI Kuwait, Bapak Rana Purnama Lahardi, Sarjana Keperawatan. Dan insya Allah saat ini sedang melanjutkan magisternya di Usyahid. Untuk kepada Bapak Rana Purnama Lahardi, kami persilakan.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.
Alhamdulillahirrabbilalamin. Assalatu wassalamu ala asrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in amma ba'du. Alhamdulillah, kita selayaknya kita panjatkan puji serta syukur kehadirat Allah Subhanahu wa taala. We have to thank everything to Allah Subhanahu wa taala and salawat and salam for our Prophet Muhammad sallallahu alaihi wasallam. Here I would like to thank to our ambassador with respect His Excellency Bapak Tri Tharyat, always supporting our program offline or online, and thank you also for supporting everything. Then I would like to thank to embassy or Indonesian embassy staff that juga di sini hadir. And with respect here, Dr. Ashraf, thank you for joining with us and giving the lecture for our nursing community, and our proudly also here, Metron Huda as Assistant Director of Nursing. Thank you so much. We need our this one mental health subject for us. Dan saya juga ucapkan terima kasih kepada seluruh panitia dan partisipan yang sudah hadir di acara kami. Sebenarnya, actually I'm not capable to speak about mental health here because I just want to share about the information that what happening to us. Maybe I will share some screen. Sudah kelihatan ya?
Oke kan. Di full screen aja kan.
Yeah, okay. This I want to share about information here. Nurses during pandemic. Jadi this one I got from newspaper that already viral in our place in Indonesia. Maybe there is 4 news here I got. The first one di Semarang. Jadi jenazah perawat Indonesia, ditolak oleh warga ya. Ini di mana nih? Di Semarang, di Swakul, Ungaran. This is during funeral. Is our staff nurse who are passed away because of COVID being rejected by the people. And the second one, our staff nurse also rejected by the owner of dormitory and hostel because they are afraid there will be the owner or the owner, they will be affected also or infected by COVID-19 also. And the third one, also this one abused by hospital or clinic visitor. Di mana di sini ada perawat yang ditampar, this staff nurse being hit by the hospital or clinic visitor. The fourth one also the same, sama juga, jadi abused by the patient. Here in Kuwait, I got the experience when I got infected by COVID-19. I finished 10 days quarantine, and when I come back to the hospital, some of the patient also refused for me to be assigned for him. So it's being we have the stress, too much stress here, and stigma also because of COVID-19. So the introduction, this one I got from researchers team from the Master of Occupational Medicine Study Program, faculty, this one Indonesian University, that mentioned 83% of Indonesian health worker experience moderate and severe burnout syndrome during the COVID-19 pandemic. I heard in Kuwait, because I was stranded 5 months in Indonesia, so I not experience 12 hours duty, right, Brother Suhardi? Alhamdulillah, for me, I didn't experience this 12 hours duty is very difficult for us. Then the COVID-19 pandemic in Indonesia also has resulted in a very heavy burden on the health service system in the country, including the health workers. Mostly it's nurses. Then the most visible risk is the safety aspect of health workers, especially frontliner, who are very vulnerable to being exposed to COVID-19 to the risk of threatening life safety. And in Indonesia, it has been recorded that more than 100 doctors and more than 100 nurses have died due to being infected with COVID-19 while carrying out health services. And also in Kuwait, we have a total population here, Mr. Ambassador, maybe less than 400 nurses. And in Kuwait, 118 Indonesian staff nurses infected by COVID-19. And 2 of our friends passed away because of this COVID-19. So how many percent from 400? Now 180. And this I got from Diaspora Kuwait. Diaspora and so many organizations and especially embassy, is concerned to protect every community or Indonesian people here in Kuwait. So total Indonesian people here who are infected by COVID-19 now 159. This on 29 November. Then mostly here is nurses, 118, and non-nurses is 41. So mostly healthcare nurses. Then this one spreading also by 56 because of the college or in the clinic or in the hospital, and 26 is from roommate maybe. Then 40, this one infected by because of the patient. They are contact with the patient. Okay. So apart from safety and protection from infection, another risk that has the potential to greatly affect the quality of the life and productivity of our healthcare professional is mental health, of course. So many of us, including me also, this one is stressful. We are facing this pandemic, COVID-19. And health workers are potentially exposed to very high level of stress, but there are no rules or policies that can protect them from a mental health perspective. So this government, even in Indonesia or in Kuwait, still they are not aware about how to gain this mental health for the health workers. Then the high risk of suffering from burnout syndrome due to exposure to extreme stress in health facilities during this pandemic can have long-term effect on the quality of medical services because this health worker can feel depressed, extreme fatigue, and even feel less competent in carrying out their duties. And this is, of course, has a negative impact on our effort to fight the COVID-19. Okay, maybe this much only as information. For more untuk selanjutnya, for more speaker, we'll let Dr. Ashaf and Metron Huda and Brother Bisri to give more explanation about what is mental health and what we have to do to gain our mentality and our to get our mentality like that. Okay, thank you, Brother Suhadi. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much for our in charge of Indonesian Nurses, Indonesian National Nurses Association in Kuwait, Mr. Rana Purnama Lahardi, who was working in Farwaniya Hospital in dialysis department. Right now, give some information to us regarding how is Indonesian community and also Indonesian nurses in Kuwait. Thank you very much, Mr. Rana. Sekali lagi terima kasih buat Pak Rana yang sudah menyampaikan informasinya. Para peserta webinar yang dirahmati Allah, selanjutnya mari kita dengarkan pemaparan materi yang pertama yang akan disampaikan nanti oleh Dr. Ashraf Saad Muhammad El-Ghazi, konsultan psikiatri Kuwait Center for Mental Health. Insyaallah, welcome to our guest speaker, Dr. Ashraf Saad Muhammad El-Ghazi, konsultan psikiatri Kuwait Center for Mental Health, for presentation about knowledge how to against this COVID-19 during this situation for us, so we can survive in our life, so we can give information for us. Falyatafaddal, Dr. Ashraf.
Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to thank you, everyone who invited me and to sharing with this nice scientific webinar. I would like also to thank His Excellency's Ambassador very much. Thank you very much about your talk, me and Madam Huda. Thank you very much. I'm so happy to be present with you, and I'm also happy to present this topic because, as you know, COVID-19 is still between us for more than 1 year now, starts at the end of 2019 up to now 2020. And still we are suffering from COVID-19 and its consequences. Still we are under stress from COVID-19. If we are looking to COVID-19 since it started at the end of 2019 up to now, we have a lot of stressors. These stressors, as you mentioned from our colleagues in the beginning of this talk, there's the most frequent word mentioned is stress. Of course, COVID-19 itself is a stress. And also COVID-19 and its consequences, it's also highly stressful to us. If we mentioned COVID-19, we are afraid. We are afraid from infection. We are afraid from spread infection to our family. We are afraid from infection to the others. So infection is one of the major fear to us. Also, it's the stress of COVID-19 and its consequences like, for example, quarantine, social distance, lockdown, the violence and the abusive behavior from the patient and from the surroundings to the nurse staff, to the doctor, to that of working at the healthy work field. It is also a stress, as well as the economic crisis coming to the most of the countries and most of populations because of unemployment, financial problem, pay cut from the salary, and a lot of, stressors. So two factors or two important stress, which is the stress and fear. These two things in our field in psychiatry, it is major factors in inducing troubles to our mental problem or our mental health. If we are looking to this slides, for example, we will see many factors. Some of them is stressors factors and the others are considered as protective factors. For example, in case of stressor factors, as we said, fear from infection, work pressure, quarantine, lockdown, social distance, and the stigma to have COVID-19 infection, which is very, very stressful to the patient and to the family if there is one of the family has COVID-19 infection. If any patient who has diabetes or hypertension or ischemic heart disease or cancer, he is highly afraid about his or her health because of COVID-19 has a dramatic negative effect on that group of patients. So we are surrounded by a lot of stressors. On the other hand, if there's a positive thinking in our mind and our behavior, if we are approaching to our God and increasing our spiritual behavior to our God, also if there is a family support and the community support, this is considered as a protective factor. But unfortunately, the negative stressful factor is too much and affecting badly our body and mind. As our my colleague said in the beginning, our body and mind should be healthy to continue our life. So what is the effect of stress and excessive fear to our body and to our mind? Unfortunately, the negative effect is too much and dramatic. If we are thinking about the negative feedback of the frequent and acute and recurrent and chronic stressors like COVID-19, which is now about 1 year or more, and also there's a frequent and repeated stressors due to that, as we said, lockdown, social distance, quarantine, loss of the job, economic crisis, and many things which is considered as frequent and repeated stressors. So the question is, what is the effect of this recurrent and frequent stressors in our body? Scientifically and medically, there are 3 systems in our body which is affecting too much by the stress since the beginning, from the first second to continue. As long as the stress is present, our body is changed to the negative picture. What are these systems which is affected by the stress? The first one is the nervous system, which is the beginning of exposure to the stress. This system is affected badly. There is some chemical substance which is called neurotransmitters or neurochemicals. These substances is important to keeping our nervous system in a good way and giving us a good function of our nervous system. In case of stress, these substances and neurochemicals, it didn't work well. At the same time, it didn't functioning well. These substances is important in keeping, the informations of the CNS to keep, constantly in a good way. So in case of stress, these substances like what's called the dopamine, norepinephrine, epinephrine, acetylcholine, serotonin, these are very, very important neurotransmitters in keeping the central nervous system and the peripheral nervous systems in a good way. So dysfunctioning of these substances making the nervous system, doing imbalance with the deterioration of its function. That's why depression and anxiety, panic disorders, phobia, OCD, even psychosis and what's called schizophrenia can be developed due to exposure of the central nervous system to the stress and the dysfunctioning of this substance. This is one of the systems which are affected. The second one is the endocrinal system. We know that there is a gland in our body which is called the endocrinal glands. This secretes a lot of hormones, keeping our body in a homeostasis and imbalance, and keeping the function of all the organs in our body is doing well. In case of exposure to the stress, for example, in acute stress, there's a secretion and over-secretions of these hormones like norepinephrine and epinephrine, which is affecting badly in our body by increasing the blood pressure to induce hypertension, ischemic heart disease, respiratory dysfunctioning, and a lot of disturbance can happen. On the other hand, also it affects our mental states by inducing panic attacks, by inducing phobic reactions, by inducing generalized anxiety symptoms, by inducing what's called maladjustment disorder, by inducing even psychosis and impairment of our cognitions and the attention and the concentration. So a lot of dysfunction of our mind and our body can be affected due to imbalance and disturbance in the secretions of these hormones. Also, there's some hormones which is increased due to chronic stress, as for example, we are now in 1 year, which is considered as a chronic stress, COVID-19. There's over secretions of what's called corticosteroids. These cortisol hormones is important in our body, but in excessive amount when secreted, it can induce the peptic ulcer, it can induce the hemorrhage, it can induce diabetes, it can induce even cancer, it can induce the depression, it can induce the anxiety, it can induce the psychosis and the schizophrenia. A lot of the disease mentally and physically can be affected due to secretion, abnormal secretion of this hormone. The third system which is affected also by stress, which is the immunity system. Our immunity system is important to protect our body against any invasion virus like COVID-19. Or any other infection, bacteria, whatever the type who are invaders to our body, this immune system is important to protecting it. In case of stress, unfortunately, the immune system, it is one of the systems which is affected markedly in case of stressors. For example, the antibodies. The antibodies secreted to attack any antigen or foreigner coming and invaded our body. This antibody became dysfunctioning either by reduced secretions or the quality of the function is reduced. That's why it is easily to others viruses like influenza, common cold, COVID-19 to invade our body because there is no defense and attacking this body, this antigen. Also, there is another type of immunity which is called the cellular immunity, which is certain type of the cells, its functioning is attacking the bacteria or attacking the virus or attacking any other invasions to our body to protecting and engulfing these foreigners and killing it. Unfortunately, these cells became confused. Instead of attack the foreign body, instead of attack the virus or the bacteria, it attacked our cells. So the end result is self-destruction of our organs, which is called autoimmune disease. So this in exposure to the stress, there are a major disturbance happening in our and occurring in our body. That is on one hand. On the other hand, our psychological immunity system, we have also a psychological immunity system defends our psychology against any stressors. In case of severe stress or recurrent stress or frequent stress or chronic stress, this immunity system of psychology became weak. and fragile. And in the result, what's called the negative adaptation. These negative adaptations making our thinking is a negative. Negative thinking, it means negative thinking about my life, negative thinking about my future, negative thinking about my environment, which means depression by itself. Also, that fearful thinking, it induced panic, it induced phobic, any types of phobia, it induced anxiety disorders, it induced obsessive compulsive disorder, it even induced psychosis and schizophrenia. So negative thinking was the end result of the disturbance of our psychological immunity system due to exposure to these chronic and frequent stressors. Also, the other negative thinking coming in our feeling, our emotion became negative, we became isolated, became depressed, became frustrated, became angry. All of these abnormal symptoms we can suffer during the time of exposure to the stress because of our immunity system, our psychological immunity system is not able to cope, is not able to face all of these stressors. That's why it became fragile and breakdown. It is the end result. Our behavior also is disturbed. Became negative behavior. We became highly impulsive, highly suicidal thinking, highly affected by all of this. Disturbance. So, sorry, there is something. I'm sorry. What happened? The slides is not here.
Yeah, slide is gone, Dr. Ashaf.
Yes, let me to yes again. Yes, I'm sorry. Wait, disappear. I see some games. I don't know what happened. Yes, yes, this one. Yes. That's why our behavior became, disturbed. Our thinking became negative thinking. Our feeling and emotion became negative emotion, with the end result of a lot of psychiatric, a lot of disease and psychiatric disorder. Okay, now we understand. Now we understand the situations when we subjected and exposed to stress, that our body and our mind is negatively affected with the development of a lot of physical and mental disease, including depression, including anxiety, including maladjustment, including obsessive compulsive disorder, even psychosis. This can happen in the person who couldn't tolerate or negatively accepted the situations of stressors. So what can we do? What can we do about all of these stressors? What can we do? Still, we continue to be a negative attitude, or we can change our mind and our abilities to be a positive. And if we want to be a positive, what can we do to share even to my healthy and to the other persons surrounding me, to sharing with them to become positive? There are some message we can sending to the general populations and even to our colleagues in the nurse staff and the other doctors and that working with the health workers, to sharing together in reducing the negativity and reducing the stress and reducing the negative reactions to this, all of this, stressors surrounding us. For example, stigma. Our colleague just mentioned at the beginning of this webinar that he suffered from, unfortunately, he suffered from COVID-19, and he suffered also from the stigma that he became like a COVID-19 patient, and everyone surrounding him became away and looking to him as infectious focus, which is very, very horrible sensations to the person who suffered from this stigma. So we try to reduce this stigma. We are not in need to attack that COVID-19 cases to say that you are a victim of COVID-19, that you are a case of COVID-19, that this family is COVID-19 family. All of this, descriptions and all of this talk is, unfortunately, it is a negative talk, induces stress, induce negative feeling, pushing the person to be away, isolated, pushing him to be depressed, pushing him to be frustrated. So try to reduce this stigma, and we try to spread the talk to the others that we are not in need to describe them by this description. It's better to describe that this one who had COVID-19, he's recovering now, he's healthy now, he's good now, his family is okay, he's functioning well. No need to describe him that you are a COVID-19 case or you are a COVID-19 victim. It's important to separate persons from having identity defined by COVID-19 in order to reduce stigma. COVID-19 persons who are affected does not do anything wrong. They just deserve support and compassion and kindness. No need to mean more stress other than he is suffering from that of COVID-19. Be positive in everything. Start by yourself. Protect yourself as you can. Be supportive to the others. Assisting others in their times of need, it can be benefit to you and even to the others. If you, send help or helping or supporting the others, it will be good for you and it will be good for others. For example, check by the telephone that your neighbors or peoples in your community, they may need extra assistance and help. Working together as a one community can help to create solidarity in addressing COVID-19 together. Find opportunities to amplify the positive attitudes and helpful stories and the positive image of a local people who have experienced COVID-19. For example, stories of people who have recovered or have supported and a loved one and are willing to share their experience. Honor carriers is important to give him like a honor because they are, and even healthy care worker, they are supporting the people who suffered from COVID-19 in our community. Acknowledge that they play an important role in saving our life and saving the life and keeping your life and safe. It's important. Okay, to continue our positivity in health authority, for example, in case of quarantine and social distance and isolations, and be positive also. Anyone who is in quarantine or in a social distance, no need to be a negative feeling towards this attitude. Try to change your behavior, try to change your thinking, try to change your feeling to be a positive. If a healthy authority have recommended limiting your physical social contact and the quarantine to contain the outbreak, you can stay connected via telephone or mobile or email or social media. Continue to the others. You don't need to be in a complete isolation. This is a physical, not a social distance. That is a physical, to keep your body away, not to keep your relationship with others. So keep in contact to continue your life. Think positively, not negatively. Try as much as possible to keep your personal daily routines as did, or create new routines in your life to make your life changing, cheerful, and happy. During the time of stress, pay attention to your own needs and feelings. Don't think about that of negative. Don't think about COVID-19, but think about your needs. Think about your feeling. It is a positive way to keep your feeling in a good way and to continue, searching about your needs. Engage in healthy activity that you enjoy and find relaxation and relax. Exercise regularly and keep regular sleep routine and eat healthy food as you can. And hear constant stream of news, bad news, especially about COVID-19, reports about outbreak can cause anyone and to feel anxious and stressed. Continuing, hearing and searching for the news about COVID-19, making us stressed, making us anxious, making us, badly feeling. So don't need to go to this behavior. Just to keep 1 or 2 hours in 2 or twice per day, just 1 hour per day or 1 hour twice per day, just to know what update about for example, COVID-19 and anything news like this, but don't keep all of 24 hours keeping hearing, keeping contact, keeping searching. This is stressful by itself. Seek information and update and the practical guides at a specific time during the day from the health professional like WHO. No need to go to do that of rumors and go to do that of others like social media and the places which is untrusted to know the information. So reject rumors and keep it with the fact. Minimize watching, reading, and listening to the news about COVID-19 that causes you to feel anxious and distressed. Seek information, as we said, from the trusted sources like WHO, and you can also practical steps to prepare your plans and to protect yourself and the loved one. Seek information update at a specific times during the day, 1 or 2 per day. Knowledge is important. Do you know knowledge is against fear? If your knowledge is okay, this means that you reduce and minimize your fear. But if your knowledge is low, it means that your fear become increase and increase. So increase your knowledge. Knowledge is power. The more you know about certain issues like COVID-19, the less fearful you may feel. Make sure to access and to believe only the most reliable source of information for self-protection. Don't keep discussing about all the times about the disease and the how and all of this, annoying questions and distressing questions. Stick to the known advices. The advices, the routine advices like keep hand hygiene, keeping physical distance from the others. It's being careful about yourself and also the care of the others. Get the fact, no rumors, no misinformations, by gathering informations at a regular interval from the WHO, for example, or from the local health authority. No need to searching in others' place. The symptoms of corona, it is well known, and so follow etiquette of the sneezing, coughing, avoiding the speech in the public place. It is just simple and helping you and others in keeping the environment clean. Most people, the chronic infections causes mild symptoms, and the persons only need to follow social distance. That is off. More than 75% of the cases or 80%, it's mild symptoms. So no need to be horrible, no need to be worried, no need to be fear from the disease and from its consequences, because the low percentage of the people who are suffering from the severe symptoms, they are needed, intensive care, and they needed more care. But most of the people, they are suffering just only mild symptoms and subsided. That's okay. Be positive also in handling emotion. Because of emotion, as we said, it is negative. We are in need to be a positive. So at the time of an anxiety, practicing healthy breathing slowly for just a few minutes. If you are feeling stress, just the relaxation technique to breathe slowly to keep your mind and your body in a peace. Try and distance the thoughts that are making you anxious. Think of something which is making you calm and slow down your mind. When feeling angry and irritating, calming your mind and counting, for example, back from 100 to 1 or from 10 to 1 like this, distracting yourself help. Even when you are feeling afraid, dealing with asking yourself these questions: what is under my control? Am I unnecessarily worrying about the worst things that can happen? When I have been stressed in the past, how have I managed? What are the things that I can do to help myself and to be a positive? Continuing about also the same feeling, that feeling lonely or sad is also quite common during COVID-19. Stay connected with others, and the communication can help you to connect and with the family and your friends. Call up your friends and your people and the people you have not spoken to them. Surprise them, contact them, talk with them. This is making you relax and making also the people you are contacting with them to be relaxed. Discuss happy events and common interest and extension cooking tips, for example, and sharing music. If any one of these symptoms persist continuously for several days, that you are anxious, if your sleep is not okay, your eating is not okay, you are stressed, all of this, talk to someone. If you still continue this, you can ask a psychiatrist. Ask for help. It's not shame to continue to go to psychiatrist and asking for help. This is a simple 4 questions you can ask yourself about it. The first 2 questions indicate if the score is high, indicate that there is an anxiety symptoms, and the last 3 and 4 questions indicated that there is a depressive symptoms. So ask yourself and answer. If the score is 0, it means good. 1, it means mild. Moderate. 2, it means moderate. 3, it means severe symptoms and severe suffering. Feeling anxious or feeling nervous or anxious or on the edge. Not being able to stop to control your worrying. Little interest or pleasure in doing things. Feeling down or depressed or hopelessness. This is a simple, what's called the personal health questionnaires. It's 4 questions asking yourself if these symptoms is present for a couple of weeks. It means that the person's had maybe symptoms of an anxiety or symptom of a depression, and he needs help and he needs, a treatment. Lastly, remember that a good mental status in a difficult time may win you and to continue against the battle of COVID-19. And wishing you health and happy. And thank you very much. Thank you.
Thank you very much for Dr. Ashraf presenting nice scientific information for us, how to against this COVID-19 during this pandemic, for save our healthy, be positive thinking. And then so many things advice for us regarding this situation. Terima kasih sekali lagi buat Dr. Ashraf, buat teman-teman semuanya sudah kita mendengarkan presentasi dari beliau. Memang mungkin ada teman-teman dari tanah air juga join bersama kita di tanah air. Sudah larut malam, insya Allah bisa diterjemahkan masing-masing sendiri tentang apa yang disampaikan oleh Dr. Ashraf. Intinya adalah kita be positif untuk melawan daripada COVID-19 ini supaya mental kita sehat gitu. Jangan terlalu banyak pikiran untuk membuat kita stres. Ya, di antaranya juga ada olahraga dari secara reguler, olahraga secara teratur, makanan secara healthy dan lain sebagainya. Once again, thank you very much for Dr. Ashraf. Nice presentation, nice scientific science information for us. Thank you very much.
Thank you.
Teman-teman yang dirahmati oleh Allah Subhanahu wa taala, selanjutnya kita dengarkan presentasi berikutnya yang akan disampaikan oleh saudara kita Pak Bisri Mustafa, sarjana keperawatan Magister Science of Nursing. Next, our lecture it is from our colleague, our brothers, Mr. Bisri Mustafa, who was working in Farwania Hospital in COVID-19 casualty also. We'll give up some information. Also, he got already this COVID-19 positive also. So he can explain to us how he's, again, the situation, then also how his problem solved with himself, then also especially with the family, actually. Okay, for our brother, Mr. Bistri, time is for you. Halo, Kang Bisri.
Okay, thank you very much, Mrs. Wardi. What time to explanation about our lecture, but please to host to make me co-host and be share my materi. Tolong saya dijadikan host.
Baik Kak, bisa dijadikan host, Mas Bisri?
Sudah. Sudah Pak Bisri ya?
Ya, insyaallah.
Ya, sebelum kita mendengarkan materi dari Pak Bisri, bagi teman-teman yang ingin bertanya, bisa bertanya di room chat juga. Barangkali ada pertanyaan ditujukan kepada siapa, pakai bahasa Indonesia aja, barangkali kalau teman-teman kita ini, atau nanti bisa langsung bahasa Inggris, supaya nanti bisa dibacakan sendiri oleh Dr. Ashraf atau Metron Huda.
Oke, terima kasih banyak atas waktunya Kang Suhardi. Terima kasih atas waktunya yang diberikan pada saya. Terima kasih pada Pak Dubes yang telah memberikan support mental dan waktunya, dan sumbernya sangat bagus sekali untuk keperawatan kita di Indonesia. Thank you Dr. Ashraf, spesialis for psychiatric and Metron Huda. Welcome to our community. Inshallah you can enjoy again next time for our presentation. Today we'll talk about I think it's Dr. Ashraf is consultant, so already complete, but I want to additional, but only the way how to look after to maintain our mental health during COVID-19. Because as we know that my wife is positive already, and I have the 3 children here, so really very difficult to manage. It's really mental support. Mental is very important. That's very right, and Dr. Ashraf explanation is really very good. Today we will try to
di full screen aja.
Yes, practicing, but this one I take from Mental Health Europe, that so many ways to control mental health during COVID-19, but here I take only 8 ways to maintain, to look after our health mental during COVID-19. As we know that, COVID-19 is unpredictable. Did we remember when the COVID-19, I remember when 31st of December, coming first time in Wuhan, and 1st January, there is one first death in Wuhan. And so the video and in the street is our business, and we are afraid to about this virus, because first time happened in our life like this. As we know, this any information, but corona can disturb in all over the world. you know, this one can disturbing everything, especially in mental, because you know, in mental health, because some people you don't know, some people's education is different. Some people education sometimes they don't know anything about the COVID-19 before, and suddenly that's coming very fast, coming to all over the world, and some people also become crazy to think about the COVID-19, and we know that almost every day there is a news, every day news about COVID-19, and sometimes hoax, sometimes is correct, but to make some people more afraid, so their mental so more crazy like that. So here we are talking about there is 8 ways with to look after your mental health during COVID-19. First, we should know that seek accurate information from legitimate source. Though when you opening any news from any social media, just make sure that information is correct. Because you know some people making news, making only make some news to make only more for money. You know, already for taking the money, so they are for viral for everything but COVID-19. But really, really making us crazy this one. So as we know that limit yourself reading information, special for WHO, and in Kuwait, I think it's every day there is a daily for conversation by Dr. Abdullah Sanat about the information about COVID-19. And our country, there's also every country there's information about the COVID-19. That's that's this information that you have to take the information that accurate. From the accurate information to avoid the fear and panic to misunderstanding any case in the COVID-19. And then for the second one, set limit around news on COVID-19. So sometimes the media almost every day at the time, almost 1 year now, the first 31st December, news about COVID never stop. There's so many news about the COVID-19. Sometimes news also is I cannot believing, and some news also is correct. So the first one is try to avoid excessive exposure to media coverage. So we have to select the news about the COVID-19. So make our stress is decreased. And there's sometimes we have to consider, don't make notification for everything about COVID-19. So make us always concentrate to COVID-19 is not good for our mental health also. And then number 3, just thinking, just focusing to yourself. Some people, when got afraid about COVID-19, sometimes they forget about yourself. Supposing me when we are dying 3 months, first time 3 months in COVID-19, start from February. This one really, this one, we are forget everything but ourselves sometimes, because we have duty 12 hours, we are tired, and then every day there is stressor, and my duty also almost one day there is 16 dead body have to pack this COVID-19 positive at the time also. So during this one, now or during this one, that you have to focusing to our control, like our good hygiene, how about the stop this one, because our routine activity. So make easy the information about this one, about COVID-19. Just focusing to your body, maintain your body, getting vitamin, exercise daily, and make your immune increasing. And the number 4 way is reach up to other to support people around you. This very important and now in COVID-19, because why? In keeping in touch, because we need somebody to share about our problem. We have somebody near with us to discuss about something in our mind, because every people is different accepted about how COVID-19 is happen to our country. So it's very important. We have to somebody with you, and then with assisting other people. It means that many people also wonder that they are put under quarantine, like Dr. Ashaf telling explanation before. They are under stress. They need somebody to share about the problem. There's more, almost all people with COVID-19, really they need somebody to support. And like me before, I'm refusing to admit to hospital because I need somebody with me. Even I'm quarantined in my room, I need to hear my wife, my children, that maybe anytime I'm pass away, that last sound I can see, I can hear my wife or my children like that, because very, very difficult. It's so supporting mental is very good for mental health during COVID-19. And number 5, that's maintaining a sense of hope and positive thinking. This one, try and focus on the things that are positive in your life. So just think yourself, what I can do about the positive thinking, just do. Because we don't know, something happen later on about our life, we don't know. But if you are thinking positive, can increase your immune like that. So with your immune increasing and fighting COVID-19 is more easily. Also in WHO recommended that the positive thinking, you can write write some novel, coronavirus. There's something positive that about corona can make easy to make our mind, mental health is become good like that. Like I heard also in Europe also that happened that during COVID-19, they make some children to make drawing of COVID virus and to teacher. Like COVID-19, not like some really happen to children. Really something make stressful for children like that. So we have to know how to make sense of hope and positive thinking. And have the recovery or who have support, love and trust in those willing to share. So this is very important also, like father and mother, children and parent is very important to take communication about COVID-19. And then number 6 is acknowledge your feeling. It's normal feel overwhelmed, stress, anxiety, and upset among a wide range of other emotional reaction in the current situation. You know already when during COVID-19 patient, really they have every people is different action about their body, because every people have knowledge different. So that's why we need somebody to expose their emotional. We need somebody to listening what they are feeling. Like almost patient come in casualty that sometimes they are coming to casualty only to checking our saturation oxygen only. But after checking saturation, okay, will become happy. They are become like free like that. During at home, they are feeling something and something. And then allow yourself time to notice and express what you are feeling. This could be by writing them down in the journal, taking the other, doing something creative, and practicing meditation. That means that this one same like before, that we'll going to positive thinking about during COVID-19. But the number 7, take time to talk with your family about the COVID-19. This one is very important when your friend, your community, or your colleagues, your community in the like same hospital, your friend in like play football player together before, and one of your member that get this one COVID-19 is really very important that when they are calling you and they need some advice, you have to answer. And suddenly you have respond. You have to start listening about what they are doing, especially in family. During I got the positive, when my wife is positive COVID-19, I have 3 children. And then the second day, there's my small children, 2.5 is getting fever. And my daughter also got fever. It's very stressful for us because I cannot do anything. I brought to hospital. But by the supporting mental, by listening what they want, and then I'm continue giving support to them, alhamdulillah, it can pass this problem easily like that. So in the face of the COVID-19, if there is something happen, supporting mentally very important. If the family cannot support for you, it cannot support for mentality, sure. You have to stay to number 8, and you ask for professional support. Yani we need to hospitalization, we need to share like Dr. Ashraf, special consultant for psychiatric. You have to go to hospital. It's very important because some people sometimes they try to solve the problem by himself. This one very dangerous for him because in psychologists, you know, we know that when the stress are coming, it can increase adrenaline. Adrenaline can make vasoconstriction, can increase the heart attack. So as a professional, to sharing what their problem is very important. Very important for support our mental and mental illness to service the organizations like that. Because when you have community, we have organization, we can share something with them, so it can decrease our mentalities. The last one, just remember that healthy body and healthy mind should be together. Because even you get a nice medicine, you got the best medicine when your health, your body health, mentality not good also, can be make worse your healthy. Like happened also to my second friend in passed away before 2 weeks, almost 1 month. That's the healthy body, but I think this in psychology they are sticking something that suddenly he passed away in the COVID-19. And then the last one, maybe we can remember that we are Muslim, that should be happy and positive thinking, because in our Quran they written that inna ma'al usri yusra, that after the difficult thing will be there is easily. So we are working together, we are supporting each other for a healthy body, for healthy mind. So inshallah COVID-19 we can fight together for mental health for our body. Maybe only this one for me. Thank you very much. We can continue to Metarunda. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Pak Bisri yang sudah menyampaikan sharing. As I thought, maybe I can call this one 8 golden ways. 8 golden ways tips from our brothers today. It is how to against this pandemic COVID-19. So it is like similar what is Dr. Ashraf advised to us, this positive thinking of course. Then also don't away with our friends. Okay, then 8 golden ways, this one, so we can practice in our life, insyaAllah, to against this pandemic COVID-19. Terima kasih sekali lagi Pak Bisri yang sudah menyampaikan materinya. Mudah-mudahan kita bisa amalkan atau bisa kita jalankan 8 program tadi itu ya. Nah, terima kasih sekali lagi. Okay, for the last speakers, we will listen together about how this in hospital, especially how our in charge, for example, this assistant director nursing and director of nursing also, how this divided this staff to maintain their mental health and everything, also their worker also smartly. So now we will listen together with our speaker. Last one, it's assistant director nursing, Mrs. Huda Mahmud Idris. She is a member of the Middle East Academic for Medicine in Aging, Middle East for Medicine of Aging in Ministry of Health, Kuwait. For Madam Huda, times for you.
Selamat malam dan sama-sama. Can you hear me?
Ya, selamat malam, Metra.
Yeah. Thank you to the Indonesian Embassy and the ambassador and the attendants. I will talk today about the impact of COVID-19. So you can see the screen.
Okay, madam.
1 second, sorry. So overcome the impact of COVID-19. All of us, we know that COVID-19 coronavirus is an infectious disease caused by a newly discovered coronavirus. And the WHO has emphasized the extremely high burden on healthcare workers and call for action to address the immediate needs to save lives and prevent serious impact on physical and mental health of healthcare workers. Now we will go for impacts of COVID-19 on health worker are increased risk of infection and the physical health outcome, burnout, depression and anxiety, insomnia and post-traumatic stress. And we know that International Council of Nursing, they give a point about that there is a strong evidence that nurses are subjected to a high level of stress, especially nursing. We can tell that they are high risk for low stress related to mental disorder. And it means that nurses, they are at high risk for anxiety, depression, post-traumatic, these points I mentioned before. Heavy workload and the fear of exposed to COVID-19. This, it will affect nurses, and when they are worried about their family also, it will affect their mental health. If they have lack of children care, it also will create a problem for nurses. And plus, if there is finance pressure or long shift, as we are telling 12 hours here, with little of eat or drink. And some people, if they got this 12-hour work, they will not get time to eat or drink. Personal protective equipment, there is shortage. Sometimes we face this point that we didn't find PPE and it's short, how we'll deal with the patients. And additionally, there are reports about nurses being attacked for working with COVID-19 patients, including what? The spit on, we face this one in our work, verbally abuse, and they are called, this one is disease spreaders. The workplace factor also, like excessive workload, bullying, and inadequate support and emotional labor have a strong impact on nurses' mental well-being. And it's required from them that to deliver also high quality care to the patients. All these stressors on nurses. Work-life balance is generally poor among nurses and major cause of stress. Longer shift, as we are telling, as we're limiting opportunities for rest and recovery, can also be affecting well-being of their mental health. The risk, including a rate of suicidal among female nurses, is greater than that the general work population or those in other profession. We know that female nurses, they found that it's a greater rate than other profession. Sorry. Suicide by female nurses was 32% higher amongst nurses than the UK national average. And most of the half of the nurses who died were not in contact with mental health. They didn't contact mental health. We'll come in a point why they are not contacting, which is suggesting a need to improve mental health care in nursing. We need really to improve this mental health care of nurses. so they can provide the proper care, high quality care, which is needed in this time of coronavirus. Society is complex and specific effect of workplace, finance, and the personal problem can all play a part in societality. And we are telling that most of nurses now, I mentioned that when they commit suicide and they didn't get mental help from the support of team, because there is stigma with mental health problem. Yani the person, he will feel that there is stigma. They will tell that he is psychotic, he is sick, he is like that. So people, they are, nurses especially, they are afraid to go to seek for help. So it will make many nurses, they will get difficulties to get support. Now, I want to give a hint about advice for managers in health facilities. It's including many points. I find that it will be effective to the nurses when they are working. Healthcare manager need to take steps to protect the mental well-being of the staff. It should be in their priority. Manager must be frank about the situation staff are likely to face. He has to be frank with his staff. Staff also can be supported by reinforcing team and providing regular contact to discuss a decision and check on well-being. If we have reinforcing team and we are giving regular contact to our staff, we will get feedback about what they have, what they are suffering, and we can help them to avoid any mental problems before it happens, or maybe we can help as managers. Once the crisis begin to reduce, staff must be actively monitored, supported, and where necessary, provide the evidence-based treatment. Manager also has to make sure that all staff receive good quality communication and accurate update. It's not only responsibility of the staff that he has to know when he has to eat, when he has to arrange his time with the patient and with his food. No, manager, he has to arrange all this plan. He has to arrange the plan itself. And to rotate workers from high stress to lower stress function, it's really a part of the manager work. Yeah, I'm not supposed to wait for the staff to come and to tell me that I am already here in a stress place. Can you please put me in another place? Manager, he has to find out where is the high stress and to rotate the workers. Partner, inexperienced worker with more experienced colleague, budding, helps to provide support and monitor stress level and reinforce safety procedure. Manager also has to initiate and encourage a monitor work break. Implement a flexible schedule, and schedule should be flexible for workers and who are directly affected or have family member affected. If one staff, he came to me and he informed me that they have a problem or they need support or they need somebody to help them, we are not supposed as a manager to ignore his need. We have to consider and keep in our mind. Initiate and encourage the monitor workplace, this already, ensure that the staff know where they can access mental health and psychosocial support services. I don't know, it's in other countries available or no, or here, that in my mind that we have to have a mental health team and psychosocial support team to be reachable to the staff or the nurses who's working in this coronavirus. All of these points we mentioned, a manager who role models of self-care are able to mitigate stress. Here also, we will not forget ourselves as a staff, self-care tips. We have to make sure that you are getting your news from trusted source. Already my colleague now, before he mentioned this point, and really he covered it very well, that we have to go through trusted sources. It's very important, because some people, they will go to media, they will go to WhatsApp, they will go to Facebook. One, he will posted his experience, which is fake. We don't know it's true or no. He will only disturb the people with reading this one, and they are going to believe. We don't know it's true or no. So we have to go to trusted sources. Limit your exposure to social media if you find it's really increase your anxiety. Think self-care. You will not be selfish at all, and nobody can call you that you are selfish if you think about your care and you take your time to sleep, you do your routine, you take your rest. All this, if you did, it's your right. Nobody will call, no, I have to do this one because I have to go for work for this. No, you have to take your adequate rest and you take care for yourself. Because if you take for yourself, you will get mental health, you will get physical health, and you can work as required from you, and you will do high quality work. Stay connected with family, of course, and the friends by phone, by mail. All of us very nice in doing video calls, alhamdulillah. Check local arrangement for key worker child care plan, so you can keep your child care worker near to your house, or you can contact them in case of you need them at any time. It will help you mentally free. PPE equipment, I want to mention hint about this one, that already PPE is designed before coronavirus to protect you from harmful substance like chemicals and infectious agent. But in pandemic situation, we use it to prevent transmission of infection between the staff and patient. It is one of the solution. The type of PPE you need will depend on the environment you work in. Yani which place you work, you need full PPE, or you need to wear this gown and the glove, you need the mask, according to environment workplace. Sorry. Remember, I want everybody to know that PPE, it's only one way to protect the staff at work. It's not the all protection. Hand washing and workplace cleaning practice and risk assessment also play an important role in infection prevention and control. I mentioned all this before, that new guidelines support to psychological need of nursing, but I need to give you a hint about this one, new guidance. I will go through it fast, but because I mentioned in points, but we have to make a priority to your needs, that you have sufficient food and the drink and rest. We mentioned this one. We have to highlight the need for communication and mutual support amongst the nursing staff when work intensity is severe. Stress the importance of openly acknowledge the emotional impact of nursing work and ensuring that staff have access to more formal psychological support if they need. We have to provide this. Recommends creating buddies up, because I mentioned this one before, that really if we are a team and we are close to each other, it may support our mental health. And it will help new temporary team member. They will feel safe and they will be welcome as quickly as possible. advices for managers and leaders. I know all of you, you need this one to be loud voice to all managers, that to be highly visible and approachable. We have, as a manager, to be in front of the staff all the time. If they want to discuss with us anything, we have to be there for them. And we have to get clear feedback from the staff itself. Propose a review of how welcoming and comfortable staff break rooms, because sometimes, sometimes we will tell this is your break room, that this one you can take your break. When you will enter, it's not a good place, or it's not enough, or it's not comfort place. In the absence of such break rooms, reproposing an existing space to enable rest and the space to be alone and the process work challenge. Now I'm coming to conclusion. The frontline healthcare workers are at risk of physical and mental consequence directly as a result of providing care to patients with COVID-19. Even though there are a few intervention studies done already, early data suggest implementation strategies we need to reduce the chance of infection. Shorter shift length, we have to reduce the shift so they will be mentally free, and a mechanism for mental health support could reduce morbidity and mortality amongst healthcare workers. Thank you, and I appreciate all your attendance. I hope that it was useful and it was brief, and I finished my talk. Thank you.
Thank you very much, Matron Huda, who was presented our program regarding how to manage it in the hospital. Actually, especially this is for the nurse. Actually, this is information for us. This is really happen in our daily activity during our working in our area in hospital. Thank you very much for Matron Huda, who was given information for us. So we hope this also, as we are the staff nurse working in the area, so only what is the order from the manager, it is like only this we can do, especially this how to dealing with this infection control, especially like that it is. So thank you very much. So we hope this it is the we can communicate nicely with the manager like Matron Huda for experience. Thank you very much. Yeah.
Thank you.
Yeah, thank you. Terima kasih buat teman-teman semuanya. Alhamdulillah kita sudah mendengarkan semua materi yang disampaikan oleh para pembicara kita pada malam hari ini. Mohon maaf. Selanjutnya kita akan persilakan kepada teman-teman semuanya untuk bertanya. Saya 2 pertanyaan yang langsung bisa bertanya, raise hand saja, angkat tangan saja, begitu ditujukan kepada siapa. Baru nanti kita lanjutkan untuk saya bacakan beberapa pertanyaan di room chat. Silakan teman-teman. Ya, Mas Adi, silakan Mas Adi.
Halo.
Langsung di unmute.
Okay, thank you. First question is for Dr. Ashraf. Doctor, is there any like a special food or something like a snack that it can make our mood is getting better, then it is possible to release our stress after doing our duty? That's the first question. Then the second question is to Madam Huda. Is there any special program from our ministry? Because there are a lot of nurses staff now in the front line in pandemic. Is there any program to support them mentally in order to support our staff mental? Okay. That's all of my question. Thank you.
Thank you very much for the first, and I can even the second answer. I can the second questions I can answer because I'm working in a Kuwait care team for that of mental health worker, and already some doctors and nurse staff under our care because of COVID-19. As regards the first question, thank you because it's very I mean excellent questions. In case of a stress and in case of anxiety or depression, or whatever the situations making us feeling upside down, there are some regular, what's called a regular style of life, which making our life healthy. And we can tolerate the stress and we can tolerate anything's coming and we can overcome the situations positively. It's not only a matter of drugs and medications to take to solve your problem, but we can changing our style of life. For example, if you do exercise every day for 1 hour, in a fixed time daily for about 6 months, it means that your life is changeable to be 100% better than before. That's one. So make as you can your life to do some physical exercise. But the physical exercise doesn't matter to go to that of heavy exercise. No, I just want from you to do just walking in open space, but in a fixed time for about 6 months. It changed our neurotransmitters and our hormones to be at a normal level, like as that of medications we used in case of depression and anxiety. That's number one. Number two, you can also change your style of life as regard to food by increasing vegetables, fresh vegetables and fruits, especially after 8 p.m. If you are increasing vegetable and increasing the fruit, it means that the electrolytes became to the normal level, the biosenses of the hormones needed to making your life happy, it has become also around the normal level, and you no need to increase your body weight, and it increasing also the healthy of the muscle and the neuromuscular systems, which is important to any physical activity. At the same time, it improves your sleep and to improve your I mean stressful situations, but it increases the threshold of the central nervous system to be above above or within the normal or above the normal. It means that you can tolerate the stress and you can tolerate anything during your work activity or overload of your work, as well as fish. If you can increase, for example, 2 or 3 times a fish meal per week, it is enough to supply your body by omega-3 and vitamins like vitamin B complex also, which is enough to make your central nervous systems or our nervous systems to be regenerate. Regeneration of the nervous system is important. Every 3 months to 6 months, our nervous system needs to be, I mean, regenerating by what's called the myelin sheath. Myelin sheath, it needs omega-3, it needs vitamin B complex. So it is present mostly in a fish. Eating fish twice per week or 3 times per week, it's important. Eating vegetable, eating fruits, it's also important. No need to take that of junk food or heavy meal food or taking at night, especially. Also regulate your sleep. If you sleep at a regular time at night and in a calm place, it will enhance your healthy mental and body situation. So regular food, yes, of course. Increasing vegetable, yes, but increasing also fruit, yes. Any type fruits, any type fresh, but it's supposed to be a fresh vegetable or fresh, I mean, fruit. Eating fish as you can. Take some drugs as vitamin C is important because vitamin C, ascorbic acid, is important to keeping the cell membrane that's healthy, which means that the permeability of the cell membrane is okay. It means that the threshold of the central nervous system will be okay. It means that you can tolerate the stress. It means that it can fight that of free radicals fighting and coming in our body. It can help making the cells healthy, and it can fight any foreigners coming to our body like anti-antigen or virus or something like that. That's number one. Number two, also Ministry of Health, it is created a team during COVID-19, and one of a member of a psychiatrist in this team. It is for, I mean, mental health worker. It's for doctors, it's for nurses, it's for, I mean, administrative worker. Anyone who suffered or faced COVID-19 or suffered from stress, he can easily join. I can send you the link of this association. It can be, I mean, apply the psychotherapy, the medications, the follow-up. I have some doctors in different hospitals here in Kuwait, and I have some nurse staff is under my care. They sent a link that is sent to go to the doctor. He will evaluate and send a message which time is suitable, and arrangements appointment and arrangements investigations needed for him, and arrangement also the follow-up and even psychotherapy. So yes, Minister of Health supply us by this team aimed during COVID-19. This from the doctor side, and not from the other side. Madam Huda, she can say and give us her.
Thank you very much, Dr. Ashraf. Okay, little maybe Madam Huda can answer the last question.
Yeah, you are asking if there is a plan from ministry to support mental of the staff team. Until now, nursing side, they are very busy with the shortage of the staff, and they are opening new places to coronavirus and the spreading of the coronavirus. But until now, we did not get any information about plan or team to support the nursing staff or to see their needs mentally about the time of pandemic coronavirus. This is what I know now. It is all
self-confidence now on the Metron.
Self-dependent.
Okay. Thank you very much, Metron. Okay, now there is one, Mr. Nadirsa Mustafa want to ask something. Silakan Pak Kang Nadirsa mau bertanya. Langsung saja ditujukan kepada siapa? Di unmute, di open.
Okay. Hi, thank you. Assalamualaikum warahmatullahi wabarakatuh. I would like to ask to Dr. Ashraf. Okay. Several days ago, I wrote in newspaper regarding the survey. Around 10,000 people in Kuwait didn't believe regarding the new vaccine that will arrive in Kuwait. I would like to ask, from your experience, what is your opinion regarding the new vaccine that will come to Kuwait? And the second question to both speaker, Madam Huda and Dr. Ashraf, will you take the vaccine for yourself? Thank you. Bye. Assalamualaikum.
Thank you very much. The question. This is not only his question. All our question. This one. There is impact or no? Is when somebody is getting the vaccine. This is now his question, because as we know, Metron and Doctor also, maybe these Kuwaitis people also, they are afraid also now if this surely this vaccine is will available and arrive in Kuwait. So maybe they will tell it is okay. We will give this expert first to trial this. What's your opinion? Thank you. Thank you.
Thank you very much for this. I mean, nice questions. And at the same time, you know, I just mentioned in my slides that there's a lot of rumors about vaccine and many things making us afraid when you are I mean, need to take it. And the Ministry of Health starts to I mean, to plan that any worker, doctors, nurse, or any worker in the Ministry of Health supposed to be I mean, vaccinated by this vaccine. To me, it's better to take the information about vaccine from the official health authorities. And if the Ministry of Health supply us by this vaccine, because we are working in this field, I already vaccinated, taken before, maybe few weeks back, that of influenza vaccine fee, because I'm working on some of the nurse staff asking me that this is a time of vaccinating of vaccine. Yes, and since this is the first year in 2020, I have no suffer from any influenza, I mean, symptoms or fever or like this, because of vaccine I take. So if COVID-19 vaccine is coming, yes, I'll take it, because it comes from the official place and it comes from all over the world. And I think citizens like in UK or USA or others who are taking it, it will be risky according to that rumors. We heard that it contains something which is against our health. So yes, to me, if you asked me about myself, yes, I try to protect, because I'm working in a field which is easily to be infected by COVID-19.
Thank you very much, Doctor. How about first question? Yes, first question. It is how about this believer of the Kuwait 10,000 people? It is not believer regarding this COVID-19. What is your opinion?
Yes. That most of the Kuwaiti people that are following like in other people in other country, you're following rumors about this. In my polyclinic, different people come to me in my OPD and asking that I heard and I read, and there's nothing, and I refuse refuse to take it. Why you are refusing to take it? Because there is something wrong happen in manufacture of this vaccine. It will be harm us. And did you hear like this videotape? Did you hear like this? It's a matter of rumors. I told him, don't follow all of these rumors. This is a vaccine. And because of this is a situations happen in a severe, I mean, and the short duration and the severe form. And thanks for the manufacturer, pharmaceutical manufacturer, to supply us by this vaccine and to help us. And the ministry is supplying it free for you. Why you're not taking it? Taking it, you are in need to take it. You are, for example, asking him about his diabetic. Yes, I'm diabetic, hypertensive, ischemic. So you are in need to take it. Try to protect yourself. But some people, yes, still convinced that they are refusing because of rumors from here and there.
Thank you very much, Dr. Ashraf. Madam Huda, little question. Did you
my
get
side,
this?
About the coronavirus vaccine, for me, all of us, we heard, of course, from trustable news, as we are telling, that vaccine is coming and they will provide for the frontline staff or doctors or like that. And if Ministry of Health provide this one, sure, we have to take. But about my personal opinion, I think I will be the last one to take that vaccine because I don't want to spoil their vaccine until they will give it for all the people. Last dose, I will take for myself. I will not be the first one who take it.
Thank you very much. Thank you very much, Dr. Huda. Terima kasih atas pertanyaannya, Kang Nadirsa, Pak Mardisa yang sudah pertanyaannya. Ini pertanyaan kita semua sebenarnya begitu, karena ada keraguan di antara kita apakah dampak, ya tadi itu seperti yang disampaikan oleh Dr. Ashraf, ini rumors begitu ya. Ya mudah-mudahan kita semuanya ketika vaksin ini ada bisa disuplai untuk kita semuanya, insya Allah. Thank you very much for answering. So I will read. There is 2 questions in the room chat, Dr. Ashraf. There is some question. This is the last, inshallah. Maybe now it is 8:30. Inshallah, last question to Dr. Ashraf from our colleague nurses, Mr. Henry Prabowo. To Mr. I would like to ask you, especially how to cope some patient with COVID positive but refuse to keep oxygen inhalation even though saturations below 90. They feel well. Another question, Doctor. Assalamualaikum. Thank you for the opportunity, and I want to ask to Dr. Ashraf how to build our mentality as healthcare staff after we confirm COVID-19 and will continuing in our duty in COVID-19 area after recovery, because sometimes we have a traumatic feeling and most afraid about it. Thank you very much. Yes, from Saudi, this one, from our colleague from Saudi.
Yes, thank you very much. I start by the second one because it's my specialty. The first one is somewhat away, but there is a link of our work to convince the patients to supply by oxygen. But to start by the second one, do you know that any serious disease or any chronic disease, once the patient is recovered, there is what is called the post-recovery depressive or depression. It happens in a lot of disease in which the patient is felt that he has something abnormal. For example, in COVID-19, after recovery, there is some questions needed to be answered. What can I do? How can I mix with my friends? That disease is a stigma. If I go to any one of my friends who will telling him that you are a corona patient, and he little mix it with me. He talking maybe in a distance, but this is making my feeling somewhat. It's harsh, my feeling, and making me in a bad attitude. This is by itself it can induce depression. But if you are following this feeling, it's a negative feeling. God help you, and you are now in a recovery, and you have now 3 attitudes: your thinking, your behavior, and your feeling. if your thinking is negatively dealing with this, I mean questions, it means that you will think negative. It means that you'll be isolated. It means that you'll be frustrated. I know one case, I know he's a doctor and he's coming to me and asking me, this doctor, I have COVID-19 and I have a quarantine for about 28 days. Now I get out from this and my health is good and I have no COVID-19. But when I mixed with my family or my wife or my kids, I'm feeling that I may spread infection to them. I kept ourselves away. I kept isolated. I feel the frustration. I have no appetite. I couldn't sleep. It means that you are in depression. This is a negative way to dealing with the situations. You are in need. You are not in need to do like this. But change your thinking. Change. This is by your thinking. That if you change your mind from a negative to be a positive by asking an opposite questions. For example, what can I do now? I'm healthy. I am good. The God sent me, I'm in recovery. I'm in a good way. Why I'm thinking, what can I do? How can I compensate what had happened to me in the past and now in the present? What can I do to my kids? What can I do to my family? What can I do? Try to build up a positive and attitude of thinking. It reflects positive in your feeling. If your thinking is negative or sad, your feeling will be sad. Your behavior will be sad. So if your thinking is positive, it means that your mood and your feeling will be positive. At the same time, your behavior is positive. So the problem coming in thinking, it starts to be a positive once you're handling the situation, once you are talking to yourself and asking questions, what are the privilege from this negative thinking? Once you ask what are the privilege from that positive thinking, you will choose. You will choose the right one. You will choose a positive thinking. You will choose to change your mind. Change your mind from the negative questions to be a positive question. After that, you will feel that your feeling will be a positive. After that, your behavior will be a positive. You can put a plan to a positive attitude instead of putting a plan of a negative attitude. It's very good questions, and we asked our clients who are following us in OBD as a doctor or as a nurse staff or even as a regular patients to change your mind. You can help. We can help him to do, for example, some practice. But when you are going to your work, to your home or to your work or to your environment, putting a plan to do some good exercise, putting a plan to following your hobbies, putting a plan to do some things happy today. And he's coming to me after 1 week. Yes, I did it, doctor. Okay, another program to do it. Step by step, he can changing his mind, he can changing his behavior, he can changing his feeling from a negative attitude or to the positive attitude. Otherwise, he can join in what's called cognitive behavior therapy. The cognitive behavior therapy, it is a type of psychotherapy needed about from 10 to 20 sessions in which we can enumerate the negative thinking in his mind, we can enumerate the negative feeling in his emotion, we can enumerate the negative behavior he did, and we started to return the positive attitude he did before, or acquiring new skills and acquiring new behavior and acquiring new feeling and acquiring new thinking to replace that of negative one. This is called the cognitive behavioral therapy, and it needs follow-up. We did it already for some patients, and we will do for some patients who needed to take it. For example, there's no need to take a medication, he's refusing the medications, or there are contraindication to take our medication, especially if he's a cardiac patient, we advise him to do what's called the cognitive behavioral therapy for it. For the second, for the first two questions, to convince the patients about his COVID-19 and his oxygen is low, and if this in your work, just send a request to the psychiatrist doctor. He will sit with him after taking his precautions and to start to talk with him. What is the negative when you are following your stubborn negative attitude not to take oxygen? And then we will talking with him about the positive attitude of the, if he needs some medications to take to make him some relax and to talk with him, we will prescribe him medications. But for you, just if you are facing like this in your, if you can do to change the mind, to change, I mean the thinking of the patients by talking with him, this is called the dialectical talk. Dialectical talk, it means that you can talking with him, struggling with his idea to overcome his negative attitudes and to implement it in his mind and a positive attitude. It will take a time from you, but be concentrate about any questions he's asking or any talk is asking, is that a negative talk or negative questions or not. If it is a positive question, go with him. If it's a negative questions, stop his talk, and to start to asking him about the positive attitude. By times, he will convince by your talk, and he will refuse and stop his negative attitude, and he will accept it. We did it already with some patients when we asking as a request to change the mind of the patient.
Thank you very much, Dr. Ashaf, for answering. Thank you very much. Mudah-mudahan yang bertanya bisa tadi apa yang dijawabkan oleh Dr. Ashaf, insyaAllah. The next question, it is from our room chat. It is for our ambassador. Halo Pak Dubes, ada pertanyaan ini Pak Dubes.
Ya, silakan.
Iya Pak, mohon maaf Pak. Ya, pertanyaan sedikit itu dari ini. Dari peserta di room chat itu, saya ingin bertanya kepada Pak Dubes, bagaimana support dari embasi kepada perawat yang mengalami mental distress akibat COVID-19, Pak? Terima kasih, Pak.
Ini pertanyaan susah ya, karena saya juga stres ya. Tapi kalau secara keahlian tentunya kami tidak memiliki keahlian di bidang penyembuhan penyakit atau masalah yang mental yang dihadapi oleh teman-teman. Tentunya melalui lembaga masing-masing, saya pahami seperti Dr. Ashaf, Dr. Huda, merupakan orang-orang yang sangat tepat untuk dilaksanakan konsultasi. Tapi di luar itu tentunya kita akan lakukan yang terbaik, yang menurut kemampuan dan sesuai dengan kapasitas yang kita miliki. Bahwa kalau sudah terlalu masalah teknis, tentunya saya tidak berani berbuat lebih, karena saya harus akui KBRI tidak memiliki keahlian di bidang penyembuhan hal-hal terkait dengan masalah stres maupun mental. Ya. Mudah-mudahan ke depan kita dibekali juga ilmu penyembuhan masalah psikis ini. Tapi untuk saat ini saya yakin ahlinya adalah mereka yang memang sudah diberikan kompetensi untuk itu, seperti Dr. Ashaf dan Ibu Huda. Ya. Mudah-mudahan bisa menjawab ya, Pak.
Amin.
Terima kasih.
Insya Allah, Pak. Ya, terima kasih Pak Dubes. Ya, mungkin teman-teman yang bertanya tadi, insya Allah kita di PPNI Kuwait atau ini bekerja sama dengan Duta Besar Republik Indonesia di Kuwait juga dengan Satgas COVID-nya, begitu, untuk saling membantu, memberi support kepada teman-teman. Jadi kalau ada teman-teman yang bermasalah dengan COVID-19, baik secara fisik, mental, ataupun tadi support itu, ya insya Allah kami dari infokan saja kepada kami tim COVID, Satgas COVID-19 PPNI Kuwait, dan kami juga pasti akan konsultasikan dengan KBRI Kuwait dalam hal ini Pak Duta Besar, insya Allah. Begitu ya teman-teman, terima kasih Pak Dubes. Insya Allah mudah-mudahan kayaknya ini teman-teman pengen tanya ke Pak Dubes biar ini aja Pak Dubes. Gitu, biar diskusi aja gitu Pak. Terima kasih sekali lagi. Kami ingatkan kepada peserta webinar, insya Allah kita akan segera berakhir pertemuan kita untuk diisi link evaluasi webinarnya seperti yang sudah dicantumkan di room chat kita untuk diisi. The last question, Dr. Ashaf, maybe it is regarding vaccine. It is safe for somebody's having this systemic lupus erythematosus. We thought this one it is SLE, like that. It is safe. Somebody's got this lupus. Thank you, doctor.
Yeah. Thank you very much. You know that systemic lupus erythematosus, or SLE, it is an autoimmune disease in which the immunity system attacking the body instead of attacking the other organism like virus. In this situation, the immune system is important. I think he needs to be referred and evaluated by a specialist in immunity system, in which he will say that these vaccines, it is harmful because their vaccine needed a proper immunity system to attack and to form an antibody against the virus. In these situations, if he has symptoms or active systemic lupus erythematosus symptoms, means that his immunity system is not good. At that point, he will not fit to take a vaccine. But if his condition is safe and his condition is settled and he's taking his medication and everything is okay, never mind to take a vaccine, because vaccine it is only for attacking the virus. It's not attacking our body, but it needs to force immunity system to be in a steady state and a healthy attitude. In case of relapse of systemic lupus erythematosus, I think vaccine, in any vaccine, not only COVID-19, it will be harmful because the immune system is not good. How can to overcome this vaccine? The vaccine, it is a very weak virus structures in which the body attacking, forming antibody to attack this, virus structure. In case of good immunity system, it means good vaccinations and good immunization. But in case of active systemic lupus erythematosus, or he didn't take a medications needed for it, I think the situations will be difficult. But to be, honest, it's better to be under the consultations of immunologists who will give you more advice and more following as regards to taking vaccination.
Thank you very much, Dr. Ashraf, for your kind answering, inshallah. Thank you very much for our speakers or our participant in our webinar today. So before we end our webinar today, there is some 1 to 2 minute closing statement from our speakers. I will start from Madam Metron Huda, closing statement regarding our webinar today. 1 minute.
I want to thank you, your embassy and honor ambassador, for inviting us. And really, I was feeling very happy to join you and to join people like you. I like really Indonesia and the Indonesian embassy. You are honest people, and it's I am lucky to be with you like that day. And inshallah, God bless you, all of you. And I hope that you get information really helpful. And thank you.
Thank you very much, Metron. So I got the underline the point. You like our Indonesian. So if past pandemic, this one, there is news information, Metron. There is new recruitment for the staff nurse. So please invite us. Then we can talk together. It is to invite to more hiring for Indonesian staff nurse, so inshallah. Especially.
Inshallah.
So if there is information from Ministry of Health, this is time for us. Especially I am represented from this Indonesian National Nurses Association in Kuwait. Just to tell, we are inshallah big most country, Muslim country in the world. So just more hiring from staff nurse from Indonesia. Okay, Mr. Ambassador.
Also to thank all the people behind the screen, which they are working hardly, really. Thank you for all of you and the people who's behind the screen, which I didn't thank them. Thank you so much for all of you.
Thank you very much, Metron Huda. Thank you very much. So for next is for closing statement from Dr. Ashraf. 1 to 2 minutes, Doctor.
Thank you very much. Actually, I have no words to express my feeling because I'm so happy to joining you and to talking with you, and I'm so happy also to hear and to listen to His Excellency Ambassador and your friends joining us here. Thank you very much. Thank you very much, and I hope the next time to join again and to do like this webinar in the next days and the next weeks to join together to talking different topics related to the stress and related to any mental problem. I'm so happy to joining you, and I cannot express my feeling because it is still too much. Thank you very much. Thank you.
Thank you very much. Highly appreciated for the Dr. Huda. Dr. Ashraf for your kind presentation today. For next closing statement dari Pak Bisri, silakan. Ada yang perlu disampaikan closing statement? Halo, Mr. Bisri. Ya, saya ke Kang Rana dulu. Pak Rana, in charge of Indonesian National Nurses Association in Kuwait. Mr. Rana.
Alhamdulillah, thank you so much for Metron Huda and Dr. Ashraf for joining our community, our webinar. This one first experience for us, and especially for Sister Lely, the one who contacted Dr. Ashraf and Metron Huda and all organizer in this webinar. Thank you so much. And sir, thank you so much for His Excellencies Bapak Tri Tharyat and Embassy for always supporting us in every situation. Alhamdulillah, that's all. Thank you.
Thank you very much. Terima kasih Kang Rana yang sudah menyampaikan. Ya mungkin Pak Bisri nggak ada. Saya langsung ke sengaja saya Pak Dubes, mohon maaf. Saya minta closing statement-nya Pak Dubes. Nah, itu yang saya harapkan tadi dari Metron Huda tadi sudah menyampaikan. Senang dengan Indonesia. Mudah-mudahan Pak Dubes, ketika pandemik ini ada rekrutmen, nah kita ini chance-nya untuk rekrutmen Indonesian staff nurse. Tafadhol Pak Dubes.
2 menit.
Silakan. lebih juga
thank you so much. Dr. Ashraf, Madam Huda, where I was asked by one of the audience when I spoke in our language, how the embassy may deal with their mental health problems. I said, I'm not the expert, so ask Dr. Ashraf and Madam Huda, because they are really the expert. What the embassy and the association can do is to help them, to facilitate them, and to talk to them. So I think this is the first step that we can do. But of course, we don't have any really expertise on healing these very serious problems. So talking about stress at the end, not only the nurses, our brothers and sisters, but of course as ambassador also with having one of the largest Indonesians abroad who are affected with this virus, I'm also facing a very serious mental problem. So with what you have taught us, what you have shared with us, and also Pak Bisri and Pak Rana have shared with us, is really something that we are going to learn and we are going to implement in our daily life. So it's very enlightening, and your tips on food and exercise and sleep and perhaps shopping and coffee may also help us, releasing our mental problems. Terakhir tentunya sekali lagi sukses untuk PPNI Kuwait. Saya merasa senang sesi malam ini, walaupun singkat tapi saya belajar banyak dan tentunya teman-teman juga belajar banyak, dan saya terus akan dukung apapun kegiatan yang akan dilakukan oleh PPNI karena saya percaya pasti bermanfaat. Once again, thank you so much Dr. Ashraf and Madam Huda. On behalf of Indonesian Embassy, we love you too. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much for our Excellency Mr. Ambassador Mr. Tri Tharyat. Terima kasih yang sudah memberikan closing statement-nya. Mudah-mudahan apa yang kita dapatkan ilmu bersama pada malam hari ini di webinar ini bisa kita amalkan. Tentunya yang terakhir buat teman-teman semuanya, kita saling mendoakan, wabil khusus kepada saudara-saudara kita yang saat ini masih berjuang ya, berbaring di rumah sakit, terutama dengan virus COVID-19 ini. Mudah-mudahan Allah angkat penyakitnya, segera berkumpul dengan keluarga dan tentunya dengan kita semuanya, insya Allah. Thank you very much once again for Dr. Ashraf.
Thank you.
And Metron Huda, also our in charge of Indonesian Nurses Association in Kuwait, Mr. Rana and Mr. Bisri also, who has given us experience, lecture, and nice advice for us. It is so we can do this in our life to against this COVID-19 pandemic, inshallah. So in the last, okay, thank you for all of participants of member for our joining this webinar. So now please all participants open your photo over your video. So we will, before we end this close this webinar, we will take a picture together, inshallah. It's okay, Metron Huda and Dr. Ashraf, no problem. We'll take picture. Okay. So please, please all of participants, ayo silakan teman-teman semuanya, silakan dibuka semuanya videonya itu dibuka biar kita ambil foto bareng-bareng. Silakan nanti saya hitung ya. Atau silakan Mbak Eka yang ngasih komandonya untuk foto bersama. Slide pertama, slide kedua. Halo Mbak Eka. Halo.
Siap Pak Bro.
Kasih komando ya, kasih komando. Silakan slide 1, slide 2, silakan. Ayo kita buka semuanya. Keep smiling. Nice, inshallah. So now we will start for picture.
Ready? Slide 1. Ayo Mas Faujan, siap? 1, 2, 3.
Next.
Sementara Bu Raufnya.
Ayo Mbak.
Slide yang kedua.
Second slide.
Nggak pada buka ya?
Okay, no problem. Just who was open the picture, no problem. Take now. Second slide.
Okay, second slide. Okay. Then now the last slide, the third one. Satu, dua, tiga. Siap, sudah.
Oke, thank you very much. Udah ya, Mbak Eka? Finish?
Sudah, slide ya, sudah.
Oke, thank you very much for our Excellency Mr. Tri Tharyat, Indonesian Ambassador in Kuwait. Sekali lagi terima kasih Pak atas kebersamaannya, Masya Allah, stay bersama kami sampai selesai acara ini. Second one for Dr. Ashaf.
Sukses selalu semua.
Amin.
Ya, terima kasih Pak Dubes ya.
Pak.
Terima kasih Dr. Ashaf.
Oke, buat teman-teman semuanya, terima kasih buat teman-teman panitia, pengurus PPNI Kuwait, tetap semangat ya. Ini memang perlu effort yang banyak dari kita, dari teman-teman PPNI untuk saling mendukung terhadap semua perawat yang ada di Kuwait, baik itu anggota yang sudah masuk anggota perawat, anggota PPNI maksudnya atau yang belum. Ini semuanya adalah kebersamaan kita untuk sama-sama kita saling membantu, insya Allah. Baik, we will close our webinar, nice experience webinar today.
Thank you. Udah.
Okay, with Alhamdulillahirabbil alamin, we will close. Thank you very much. See of us in the next webinar, inshallah. So, assalamualaikum warahmatullahi wabarakatuh. Bye. Terima kasih. Terima kasih.
Waalaikumsalam warahmatullahi wabarakatuh. Waalaikumsalam.
Selamat
sukses PPNI.
Ya, sukses. Terima kasih Pak Ibnu.
Thank you so much Dr. Ashaf and Metron Huda.
Thank you Dr. Ashaf. Thank you Metron Huda.
Terima kasih Pak Dubes dan semua staf KBRI, semua peserta yang hadir.
Terima kasih Pak Dubes.
Thank you buat semuanya. Salam dari Saudi Arabia.
Ya,
terima kasih kawan-kawan
yang hadir hari ini. Terima kasih banyak.
Thank you very much.
Sukses semua ya, sehat-sehat selalu.
Semuanya perawat Indonesia.
Semua yang hadir.
Buat Bapak Dubes spirit Pak.
Terima
kasih. Thank you very much. All of you.
Thank you so much Dr. Suman.
Dr. Suman is joining us.
Terima kasih.
Dr. Suman, thank you so much.
Ya, Dr. Suman, thank you so much for your time. Join for
Dr. Ashaf, Dr. Suman is one of our friends, also was already given one lecture. He is dentist.
Nice.
Dentist.
Shukran jazilan barakallahu. Shukran jazilan barakallahu. Thank you very much.
Thank you, my friend. Thank you very much.
Have a good night. Thank you so much.
Terima kasih Pak Dubes.
Pamit ya.
Iya Pak. Terima kasih
Pak Dubes.
Salam buat keluarga Pak. Makasih. Oke, dokter. Terima kasih. We say now you can learn Dr. Huda. Dr. Ashaf. Terima kasih. Makasih teman-teman semuanya. Ya, terima kasih teman-teman dari Saudi, dari tanah air, ya, Mas Ahmad. Terima kasih.